Hi, my name is Justin Embry. I'm a physical therapist here at Copper Queen Community Hospital, and I'm also the rehab manager. So I'm here to demonstrate the proper use of a gait bell when you are transferring an individual or having them stand up so that you can do some linen change or some hygiene with them. Please make sure that when in doubt, you definitely use a transfer belt. They take a little extra time, but it can be well worth it to protect your back and to give you a long life working in healthcare industry. A couple things about gait belts. We have different sizes. So as our ever-increasing population continues to grow out, this is a standard gait belt size that you will see on most units, okay? But if I hold up a larger one, you'll see the difference in size here. So there's a lot more addition to this gait belt. So this would be a bariatric gait belt and then a normal size gait belt, okay? So when in doubt, when you go into an individual's room, I would have the bariatric gait belt, okay? But if you don't have access to that, you can use two different gait belts to make a bigger one. And so what it looks like is this. You see the T side of the belt, okay? You simply take the opposite belt and you stick it through and then through the hinge part of the belt. Okay, and that creates a very strong, tight pull. I cannot pull that out, okay? And then you have your other two openings to work with to put it around an individual. I've got an individual here, Miss Patty, who is pretending to be one of our patients today, and so I'm going to demonstrate putting a gait belt on her, and we're going to do a sit to stand movement. So Patty, by the looks of her, needs a regular size gait belt, and that's what I'm going to use. Now, what I see a lot done in the nursing world is that the gait belt is put on too high for the individual, so they come around under the shoulders. So if I were to do that, and I would ask Miss Patty to lift her arms up, what I see quite frequently done is that the gait belt is put up here, and so if you can imagine when I go to lift her, basically what I'm helping assist is just her shoulders and her neck and head. And the rest of her body, I don't have good control or support of it. So you're going to have a harder time lifting the individual. Also remember, on a lot of elderly and frail folks, they already have shoulder problems, and so you can actually aggravate a shoulder condition, so you want to be very careful with that. Now, there might be times to put it there if an individual has had stomach surgery or they have a colostomy bag or some other medical device down in that area that would preclude you from putting it there. But normally we want to have it around the waist. So what I'm going to do on Patty is I'm going to go down lower, make sure it's down around the top of her pelvis or in that area, okay? And then I've got the teeth side facing the belt. So I'm going to put that through. I'm going to make it nice and snug, and make sure you let your patient know that you're doing this. Say, please let me know. How's that feel, Patty? You feel snug there? Not too uncomfortable?
Mm-hmm.
Okay.
That's good.
And then I'm going to slip the other part through the hinge part of the belt. Okay. Now you see I've got a couple feet left. What you can do with that for safety purposes is you can stick it through the back of the belt like that, so you don't have a bunch extra hanging down, okay? So now I've got my patient, Miss Patty, here on the edge of the bed. I've put the gait belt on properly, and we're just going to demonstrate a sit to stand, and I'm going to show you the technique that is best used for that, okay? So what I would ask the patient to do, if they can, is scoot a little bit more forward on the bed. You want their feet to be on the floor. That's very, very important. They need to be able to contact the floor. So what I'm going to do is I'm going to get close to the individual like this. You want to make sure that you spread your legs and get around them like so. And then you want to lower yourself by bending your hips and knees. So now I'm down close to where the patient is, okay? And then I'm going to grab on each side of the belt like so. All right. Now, you need to think about what you're going to ask the patient to do. A lot of patients just initially grab the top of your shoulder like this, or even the back of your neck. Please be careful with that because they can hurt you. I would ask the patient to keep their arms at their side and actually use their muscles of their arms to help push up. So direct the patient to push up as you stand up together. I'm going to brace one of the patient's knees on my leg like so, but make sure that you have something on their feet for friction. So at minimum, they should have the hospital socks that we give to every patient that provides that necessary friction to help them stand up so that their legs don't slide out from under them. Okay? So, Miss Patty, we're going to do this on 3. Okay? 1, 2, 3. What I've done is I've helped this individual stand up. I'm close to them. I'm supporting their body weight. Their body is very close to the middle part of my body, my belly button and my spine, so that I'm protecting myself. And I've got a good grasp around their low back pelvis area. And then you can either do the things that you need to do or have the individual set back down. So, Miss Patty, would you reach your hands back? We're going to sit down. 3, 2, 1, down. And that is a demonstration of the proper use of a gait belt on a sit-to-stand maneuver. Thank you.